So what we want to do while we're in this position is look at the hip range of movement. How does this look right versus left? Are we seeing increased or decreased range of hip flexion in this position? This is a really nice test of that rectus femoris and the hip flexors. What we'd be thinking, if there is a kind of quite severe proximal injury within the rectus femoris in particular, we might see increased range of hip extension because we're not getting the normal ranges of tension, particularly if there's a real severe tendon injury, which has caused kind of loss of tension. We might even look at the end feel of that and try and feel how that feels. We should expect to see a nice kind of springy end feel. However, with a loss of tension in the tendon, that kind of elastic element has been damaged, or we might feel like a softer end feel without that recoil coming to it, and we compare right to left. Whilst here, it gives us a really nice opportunity to also wind that rectus femoris up even more, and if you kick into my leg for me, perfect. That's a really nice test of that direct head. We're in an extended position, we know that's going to be really taut, and we're also getting a test at length as they perform that knee extension action. And like I say, again, we compare right to left. We're thinking about pain, loss of strength in that range. It's a really functional position, thinking about that running gait pattern with the hip in hip flexion on the opposite side, that nice 90-90 position into an extended position on this side. So the next area of assessment, we've got our patient in prone on the bed, and we're going to look at a few different areas. So the first thing we'd be looking at is that prone knee bend. We're looking at range, and we're also looking at provocation of symptoms. Where are they feeling that? Again, thinking back to that anatomy all the time, the hip's in an extended position, so it's going to be a good test of the rectus femoris. So by adding in knee flexion, yes, we're stressing those vasti group, but we're also going to be stressing the proximal aspect. And one really nice test in this, again, as it was in the Thomas test, thinking about end feel, trying to think back to what anatomy is involved, is to perform both prone knee bends at the same time. So we're looking for not only range, but we're looking for how that end feel feels. So as we come up, is one nice and springy? Does it come back? Is one kind of quite soft and you feel like you could keep going with it and it doesn't really give us much kickback? Again, thinking to the elasticity of this. And this is not only a nice test in the acute phase, it's also a nice test within kind of ongoing markers of rehabilitation, especially when there's that intramuscular tendon involvement. Are we getting that stiffness back in the tendon, or is one going much further than the other still, and there's that asymmetry? Thinking back to the action, we need there to be stiffness in that tendon and the elastic element, so we want the end feels to kick in at the same point and also to feel the same. So that's a really nice test in this position.